So I have some clinical features of MI listed for you on this slide. Okay, so I believe you know this, how the pain is and how it radiates to the neck, jaw. It could be epigastrium or the left arm. So left side you are very familiar, but sometimes it could be given as epigastric pain. Then you confuse this with GERD or something else, which you should not. Okay. Diaphoresis, dyspnea, okay, not relieved by vasodilators. We're talking about MI here, so it would not be relieved by vasodilators. Our question said pain relieved by vasodilators, which told us this is temporary, but MI is not temporary. MI is reversible damage, isn't it? So sort of irreversible damage, sorry. Silent MI happens in elderly patients, usually who have hypertension, diabetes. 25% can develop sudden death. So, what is okay? Now, this is an important question. If a patient survives after MI, what are some of the things that might happen? Okay, so you see, number one thing is cardiac arrhythmias. So does that mean even if this patient survived, 75, 95% of your patients who you treat well after MI, you save their lives, can still have an arrhythmia, can still undergo that sudden cardiac death? Yes, any day that can happen. Okay, so it's not too straightforward. It's a tricky situation. LVF, so this is left ventricular failure with pulmonary edema. Whenever the left ventricle is failing, backup pressure builds up in the lungs, and that leads to increase of hydrostatic pressure, and the fluid moves out of the pulmonary vessels and collects in the lungs, and the patient has that pulmonary edema and dyspnea and nocturnal dyspnea, all of that stuff. Cardiogenic shock because of disruption of heart muscle, so this is 10%. Rupture happens in 4 to 8%. Okay,